sounds.
Bilaterally.
Bilaterally.
Make sure you say bilaterally. Just like equal grip bilaterally, or good strong 2+ pulses bilaterally.
So there's no crackles
Or what? What's another name for
or rails.
It's R-A-L-E-S, but most people say Rawls. Like Lou Rawls, the singer.
So
Rawls.
it's raws, not rails?
Most people say Rawls, but now they're saying crackles a lot more. Very few people say rails. So what is that indicative of if there's crackles?
That you have fluid in there.
Fluid. So remember, fine, lower,
Fine
And then
in the lower.
coarse.
Of course.
and if you don't do something about it, give them medications.
Yeah.
They'll drown, that fluid will start coming up, and you'll see pink, frothy sputum. Frothy is with bones
Pink
in it.
because of blood.
But pink, frothy sputum.
Okay.
And that's usually indicative of left heart failure. What does that mean? That the patient had a heart attack, probably on the left ventricle, on the left side, and that part of the heart is not pumping efficiently.
To the rest of the body.
So
So
when
it's
the
backing up into the lungs.
So when the blood goes into the right atrium, right ventricle, lungs, picks up oxygen,
Left atrium.
the left side of the heart can't handle what's being sent, so
From
it
the
pushes
lungs.
some of it back, and it goes into the lungs.
So would you hear a murmur too?
You would hear mostly crackles.
But I'm saying if you assess the heart,
No, not necessarily.
what would you hear differently?
You would just hear crackles.
Because I thought a murmur was when there's
Murmurs when,
regurgitation.
right, but the regurgitation is just into the atrium, from the ventricle to the atrium.
Which atrium?
Depends on which one. Usually it's the left ventricle. The
Oh,
left
okay.
ventricle,
So when it's regurgitating back into the lungs, you're not gonna hear it. As a
right,
murmur.
you're gonna hear crackles of the lungs. Especially, you'll know a patient with severe pulmonary edema or congestive heart failure, as soon as you walk in, they're gonna be sitting here with that feeling and look of impending doom. They're gonna be cool, pale, diaphoretic, and their work of breathing is gonna be at a high level. They're in distress. With those patients, when they come to you, get to work right away. You don't sit down and ask them, so how are you feeling today? You take care of business because they're gonna crash on you. Those patients, you gotta intubate quickly. You have to take control of their airway.
Okay, so
And through the ET tube, sometimes you can suction the fluid out with a French catheter. You have the ET tube going into the trachea. It sits right above the carina, which is the point where it
Where it
splits
splits
into the
into-
right and left mainstem bronchus. And then you can put a French suction catheter through there and suction some of that fluid out. If not, the ET tube is gonna get full also. And they won't be able to
if they have left heart failure,
left heart failure, backs up into the lungs.
are they
Right heart
gonna
failure,
have
it backs up mostly systemically. That's where you see the pitting
edema?
pedal edema.
That's right.
Plus
heart
one,
failure,
plus one, plus two, plus three, plus four.
Because that's blood coming from the body back into the heart.
So you go like this, it's like putting your finger in dough.
It's
You
gonna
know,
stay.
and it's gonna stay.
So when they have left heart failure, are they gonna have cyanosis in their toes and in their fingers because the blood's not reaching?
It depends on what their condition is. They may, but that's not
That
what's
makes sense.
important. What's important is you gotta clear those lungs out, or else they're gonna die. They're gonna drown.
And they're probably not having a lot of oxygen.
And then once you clear that, remember, whenever you come across something emergent in a patient, you don't finish your exam. You take care of that. You don't say, oh, you know what? Let me check the pedal pulses. Oh, good pedal pulses, and they're not breathing. Okay? Whenever you come across something, you take care of it, and then you go back and finish your exam. And then you could be in the middle of the exam, all of a sudden, and they might crash on you, go into cardiac arrest.
Wait, how about this? How about you give me a scenario and I'll tell you, like for example, I'll tell you what I should do as a nurse. For example, you tell me, okay, this patient came in and he's feeling this, he's feeling that, what do you think he has? And I'll tell you what I think he has.
Okay. So, patient comes into you. 20-year-old male, and he's weak, dizzy, some altered mental status, kind of like, head bobbing, and he's your patient.
Mm,
What do you do?
what do I do? I test his mental status first.
Okay, mentation. Sir, can you hear me? Yeah, I'm just kind of weak. I feel like I'm getting ready to pass out.
What, did I just find him in the street or something?
No, they brought him into you. Somebody brought him in a car, and now he's your patient in the yard.
Nobody knows anything about it.
Nobody knows.
I take his vital signs.
Friend dropped him off, say, I don't know what's the matter with him.
I take his vital signs.
Okay,
So what does vital signs come
vital
out?
sign is 90 over 62.
So his blood pressure's low.
Okay.
What about his heart rate?
Heart rate is 110.
And his pulse oximetry?
Pulse oximetry is 95.
So it's normal. Okay, so I ask him what
I
happened.
don't want to pass out.
I ask him what happened.
I don't remember. And he passes out.
Okay, so and when I assess him, what do I see?
What are you assessing?
At his whole body. I'm looking at him. What am I
Okay,
seeing?
patient just passed out on you.
It's breathing.
Sir, can you hear me? Check a pulse.
Oh, okay.
Okay, weak pulse. Brachial or carotid, good strong pulse. So he's alive. Why did he pass out? Did he go into cardiac arrest? Okay. What do you need to check on this patient? The friends there says, I don't know, man. I don't know his medical history. I don't know anything about him. Okay, so he's got a blood pressure. It's a little bit low. He's got a pulse, a little bit tachycardic. It's cool, pale, diaphoretic. So, could be having what?
Heart attack?
Could be having a heart attack. How do you rule out a heart attack? Rule out MI, myocardial infarction.
How do I rule out?
Hey, bring me an EKG machine. Throw some leads on.
He's
Okay.
not having a heart attack because his pulse is, you said it was 100, right? Or
You can have a heart attack with a pulse of 80, with a pulse of 100, with a pulse of 200. A heart attack is just blockage of blood flow to an artery in the heart. It's not cardiac arrest. Okay? A heart attack can lead to cardiac arrest. Cardiac arrest is the heart stopped. His heart hasn't stopped, but he could be having a heart attack. Okay? So you want to do a 12-lead EKG. You want to put him on oxygen. Okay? What medical conditions
what
could
do I put him on oxygen for? If his oxygen is fine.
you want to put him on oxygen? Not rebreather mask. What if he stops breathing or it goes lower? Put him on oxygen. Okay?
But I can't hear.
Might even have to bag him. Okay, assist the respirations.
Like put a tube in him? And
No.
bag him?
Bag him with a mask and a bag valve mask
Yeah,
or
pushes
an
air
ample
into
bag. You're forcefully pushing air. Okay, you're making what's called an EC seal. This is the tube right here, and then you're holding up here, and it's hooked up to oxygen. You may have to.
So what if that air goes down his stomach?
Don't worry about it. That's not the important thing right now. He's passed out. Could be having a heart attack. Okay, they do a 12 lead on him, no heart attack. It looks normal. A little bit tachycardic. What do you want to check on him? Check. You check his pockets, and he's got little packets of sugar in there and candy.
Like diabetic.
Right away, man, you gotta get a glucose.
Glucose.
Right away, you gotta get a glucose. Okay, you get a glucose, and it shows error. What do you do?
Air?
Error.
Get another one, do it again.
Get another one. Make sure you got a good drop of blood. Make sure now it shows 25. What's normal glucose?
Oh, I don't know. Forgot.
70 to 120
70 to 120. So he's
milligrams per deciliter.
So he's
Hypoglycemic.
So I give him some candy. Or I
He's
give him
passed out. You don't
So-
you don't give anybody that has altered mental status or maybe the inability to swallow anything by mouth.
So I put
No
him on
fluids,
IV
no
dextrose.
food. Okay?
Dextrose
So
IV.
you have somebody start an IV on him, and you give him D50W,
And
which is
glucagon.
half water, and you give him D50W. He can't swallow. Glucagon is in the mouth. He can't
No,
swallow.
but glucagon.
D50W,
Okay.
or glucose is actually in the mouth. So it comes,
Glucagon isn't in the IV?
right, but it's a little tube, and it's like toothpick. You squeeze it in the mouth if they're able to swallow. If they're not, you don't give anything in the mouth.
So you give them half D50?
You give him the whole tube. It's half sugar and half water. It's D50 delegate, 25 grams of sugar. And within a minute, he's gonna be waking up. Okay? Now you take his sugar again. Now it's 210.
No, you gotta give them.
No, you don't give him anything. It's high. It's okay for now. All right? Now you say, hey man, what happened? He's, oh my God, I went out drinking last night. I was supposed to, take my medications and I didn't, and I just forgot. And maybe I just took too much. I don't know if I took too much insulin or something. I don't know what happened. All right. So his friend found him, laying at home, couldn't wake him up, threw him in the car, and brought him to the hospital. All right. So you just saved that patient's life. That's the miracle drug. They think you're God. You're like, whoa, wait a second, he's perfectly fine. So now you gotta monitor him. You're in the hospital. You gotta monitor him, make sure he's okay. Probably have him eat something. If it's something that happens at home, you make sure that somebody's there with him. You recommend they go to the hospital or take him to the hospital yourself if you're fire rescue. You gotta check glucose right away. Any altered mental status, check glucose.